Mr. Hazzard, thanks very much for your time. When you look at the situation in your state and then you look to Victoria, what was the key mistake that has seen this outbreak happen in Melbourne?
I don't think that's fair for me to draw that conclusion. I think that all of the state and territory governments, Labor, Liberal, have worked very well together. I think we shouldn't be either cocky or complacent in New South Wales or indeed in any state or territory. These sorts of issues can occur. It's a human system. I think people expect a little too much from time to time because science and medicine are still very much subject to human influence in the sense of what people do in their day-to-day lives.
Sure.
Here in New South Wales, we have been very lucky that our community have listened to strong health messages, and we've had the public health system, particularly through our local health districts. We have 15 local health districts in New South Wales, and the majority of them have very, very proficient public health specialists, and they're able to relate closely to their local community. So we've had very good source of information. As I understand it, it's been publicly stated that Victoria did have a problem in their quarantine hotels with some security staff. I saw Premier Andrews yesterday indicating that there was some genomic studies that indicated that some of the source of the clusters that are now occurring in families in hotspots within Melbourne came from some of those security staff. And I would conclude, as probably he's concluded, that perhaps the staff were not effectively using their personal protective equipment, or perhaps not doing what needed to be done. But, you know, it's a human system, and no one should, in my view, no one should be pointing the finger. I've seen some outlets making commentary about the government in Victoria. I'm not, as a Liberal minister here in New South Wales, I'm not making those comments. So I think it's a tough gig when you're trying to work with a 1 in 100 pandemic and know how to actually relate to your community and all the multi-sections of that community to make sure they hear the messaging.
Yeah, well, fair enough. But for the grace of God, I guess that's the view, and understandable. But, you know, how worried should we be given what we're seeing today, another 70-plus cases?
Kieran, I think we should all be concerned. The Victorians have done what I think makes sense, that is effectively locking down their hotspot suburbs. And we are concerned here in New South Wales. By midnight tonight, I will have signed as the Health Minister under the Public Health Act here, new orders which will make it very clear that if anybody decides to try and slip out of the Victorian hotspot lockdowns and slip across the border into New South Wales, it won't be a welcome they'll be getting. They'll be getting the opportunity to have 6 months in jail and $11,000 fines. So I think they need to take seriously and listen. The community must listen to their government in Victoria, must listen to the health authorities in Victoria, and they must abide by the lockdown because it's in the interests of not only their community but the rest of Australia. So we're certainly making and backing Victoria in terms of whatever we can do to keep New South Wales safe, but also to send a clear message to those Victorians that they need to comply. And certainly don't come to New South Wales. There might be the odd exemption where someone who needs a hospital treatment that's only available in New South Wales. Well, that's a different ballgame. But that'll have to be done by way of exemption. Otherwise, people crossing the border, coming into New South Wales, run a very grave risk of very substantial penalties.
Yeah, they certainly are. You and the Berejiklian government broadly, $11,000, as you said, 6 months jail for anyone from those particular hotspot postcodes, the 10 of them. And this is, this is running parallel, the very strong stance you're taking, to the Premier's broader argument about the need to keep the borders open for economic engagement. Is that, is that consistent?
Absolutely. What we've done right through, we've never closed our borders. We have actually now taken steps today. In fact, we are strongly of the view that no states or territories should have actually done that. But you know what, as I acknowledged at the outset, we're not in a position to judge other states and territories or other leadership or groups in Australia. But we are strongly of the view that having an effective response to COVID-19 is a mixture of getting the public health messaging right, getting obviously the health right, that is the treatment that's available in our hospitals. And We've nearly more than doubled the ICU capacity, and we're still increasing our our intensive care capacity here in New South Wales. So we're still taking all those measures, but we're also very conscious that the economy must be, as far as is possible, maintained. Jobs are critical for a whole lot of reasons, not least of which is mental health. So we've taken a different stance, and Victoria's been with us on that. Neither one of us have put up our borders, but now Victoria's taken a step to lock down particular suburbs. That changes it slightly insofar as we can back our Victorian colleagues by saying, don't come into New South Wales, stay where you're supposed to be, stay exactly there, and don't come into New South Wales. And if you do, you're potentially, as I said, going to be exposing yourself to very substantial fines. I'd also say that my message on behalf of the New South Wales community and government is, if we have families or members here, individuals who are thinking of visiting family or friends in the hotspots in Victoria, don't do it. Do not do it. One, you'll be liable for penalties in Victoria, and two, if you then return to New South Wales, we'll be putting you into lockdown for 14 days. So there's not a lot of sense in New South Wales residents doing that. If they want to talk to their families down there, do it by Zoom or do it by telephone. Don't go down there for the time being. But our borders will remain open to the majority of Victorians, the majority of Melbourneites and the majority of Victorians.
Yeah, 5 million Victorians apparently not in those hotspots. So we're talking about a big part of that population. Just finally, from your advice, from the advice you're getting from Kerry Chant and others, do you feel hopeful that the Victorian system, and with the help of New South Wales and other states, I know, providing experts, can they get a lid on this? Can they get on top of that outbreak?
Well, let's not forget, and again, it goes back to not being cocky or complacent. New South Wales had 212 cases at a maximum back in March, when it was very, very challenging in parts of Australia. And so Victoria has now had 60s and 70s the last 3 days. I think that it is capable of being managed, and we have sent down public health officials to assist. We're doing tracing for Victoria. We've offered our expert tracers. When you get a positive case, the most important thing is to be able to break the chain of transmission, and that means asking the right questions of the person who is positive as to where they've been, who they've been in contact with. You need experts to do that. We've got the experts here, very experienced people in New South Wales, so they're now doing that for Victoria as well. We're basically offering whatever we can to Victoria. And I know the Queensland Labor government, the South Australian Liberal government, the Tasmanian Liberal government have all offered help to Victoria. This is not about politics. This is about making sure that we, as Australian citizenry, are all together in this and make sure we work hard to support each other. And certainly New South Wales and Gladys Berejiklian and John Barilaro have been very supportive of our government supporting the Victorian community to beat this COVID-19.
Brad Hazzard, New South Wales Health Minister, thanks. Appreciate it.
Thanks very much, Kieran.